So, Norman, what's the story with bariatric surgery?
Well, Casey, there are more than one operation involved in reducing the weight of people who are really obese. And at the moment, to qualify, you've got to be pretty fat and life-threatened. But as time goes by, the bar is being lowered. In many countries, the commonest operation is actually shortening the bowel through a fairly radical operation to reduce its ability to absorb calories and nutrients. In many countries, these operations aren't commonly done because they're irreversible and have a significant risk of side effects and complications. One of the most popular operations in bariatric surgery is gastric banding. It's performed through keyholes in the abdomen, and they create a small pouch with the band which slows down the passage of food into the rest of the intestine. So you have to eat slowly, and you do feel full sooner. And as time goes by, the band can be adjusted to be tighter or looser. Now, for banding to work, you've got to be committed. There's no getting away from a calorie portion-controlled diet. You can't cheat by liquidizing your hamburgers and chips. But bariatric surgery in a committed person can have dramatic effects with long-lasting weight loss and even reverse diabetes. But it's a big step. But some of the other options, Casey, are a bit dubious as well, aren't they?
Well, not all, but certainly some. You need good information to decide, and some things do work, like meal replacements.
With actually cutting the amount of food eaten, there are replacements, either powders, bars or shakes, and one can, of course, just have the meals delivered completely to your house.
Then there are complementary and alternative weight loss products. It's big business and you hear a lot of claims, but what do they actually do?
I'd be very interested as to what they're doing. I believe most of them are doing absolutely nothing.
So what do they claim to be able to do?
Some of them seem to get rid of toxins, which I can't identify. The body does that already. And why toxins should make you fat, I don't understand. Your liver and your kidney get rid of your toxins, otherwise you die. How much do these toxins weigh? I can't understand it, and there's no scientific evidence to back it. So it's an absurd concept. Others wash your bowel and your kidney and your liver out. Again, horrifying thought. I personally wouldn't like that. Why would you need that? And why would that make your weight any different? Other ones have strange herbal extracts, but they're not well described, and no registered trial evidence to show how they work. HCG, or human chorionic gonadotrophin, is another hormone in the body, one that particularly plays a part in pregnancy. I am personally not aware of any scientific evidence that it is a weight loss agent. However, yet again, it is being promoted, used and injected to cause weight loss.
How does a pregnancy hormone cause weight loss?
It would be difficult to understand that. I think is part of the tradition of giving hormones to try to produce weight loss. Growth hormone has been misused quite substantially recently for muscle development and weight loss. And prior to that, thyroid hormones were given out very freely for weight loss and were actually lethal.